Okay, let's unpack this. We all love our pets, right? The cuddles, the funny things they do. They're just part of the family.
Absolutely.
But let's be honest.
Right.
Sometimes they produce certain sounds and
Oh,
smells.
yeah. The infamous pet flatulence.
Exactly. That room clearing phenomenon. Sometimes it's funny, sometimes it's just powerful. And, occasionally you wonder, is that normal? Is something wrong?
It's a really common thing owners wonder about. And while, yeah, a bit of gas might seem minor, people are definitely curious about why it happens and what, if anything, they should do.
Right. So for this deep dive, we've looked at some pretty detailed information to get a really good handle on pet flatulence.
We have indeed.
Our mission today, essentially, is to arm you, the listener, with a better understanding of why your furry buddy might be, well, a bit gassy.
We'll cover what flatulence actually is, what causes it, could be their food, their breed, even how they eat.
And crucially, when it might signal something more serious that needs checking out,
Uh-huh.
we'll also touch on, possible ways to manage it.
So yeah, get ready for a hopefully not too odorous journey into the world of pet gas.
Okay, so first things first, what are we actually talking about when we say flatulence in pets?
Well, simply put, it's gas coming out the back end. Flatus, technically.
Right, flatus.
Yeah.
And the sources we looked at are clear this is different from, say, a burp.
Totally different. A burp or eructation, that's gas from the stomach coming out the mouth. Flatulence is strictly the rear exit.
Gotcha. So where does all this gas even come from inside them?
Good question. The information points mainly to two big sources. First, just swallowing air.
Aerophagia, is that the term?
That's the one. Think about a
Phagia.
dog just gulping down its food really fast. They swallow a lot of air doing that.
Makes sense. And the second source?
That's the bacteria living in their gut. The microbiome.
Ah, yes, the gut buddies.
Exactly. When these bacteria break down food, especially stuff the pet hasn't fully digested yet, they produce gas as a byproduct. Fermentation,
Yeah.
essentially.
So swallowed air and bacterial fermentation, are there others?
There are minor ones, yeah, like stomach acid reacting with bicarbonate, or even a tiny bit of gas moving from the blood into the gut.
Oh.
But swallowed air and bacterial action are the main players.
Okay. And that bacterial part, that leads us straight to diet, doesn't it? What they eat must be huge.
Absolutely massive.
Hmm.
The connection is crystal clear in the sources, especially diets that are, well, harder to digest.
How so?
If the food isn't broken down and absorbed properly higher up in the small intestine, then more undigested stuff reaches the colon.
Where the bacteria are waiting.
Exactly. And they ferment it, producing gas. Simple as that, really.
Are there specific food ingredients we should be aware of? Things that are known gas culprits?
Oh, definitely. The sources highlight things like certain types of sugars called oligosaccharides. They aren't absorbed well.
Where do you find those?
Things like whole grains, soybeans, beans, peas. Foods like that can be triggers.
Okay. What else?
Spoiled food, obviously, that's never good. High-fat diets can also contribute. And milk products.
Ah, lactose intolerance, like
Oh.
in people.
Precisely. Dogs and cats often don't handle lactose well as adults. One source even mentioned that giving a pet something like, say, 1.5 grams of lactose per kilogram of their weight daily, which isn't a huge amount, could cause problems.
Interesting. So watch the dairy. What about things like spices or fiber?
Yep, spices can sometimes be irritating, and fiber is a bit of a double-edged sword.
How do you mean?
Well, too much fiber can sometimes make the whole meal less digestible overall.
Mm-hmm.
But also, certain types of fiber are very fermentable. The bacteria love them.
So even healthy sounding fiber can contribute to gas.
It can, yeah. Things like pectin, inulin, psyllium, oat bran,
Yeah.
they're fermentable. And it's worth noting, too, sudden changes in diet.
Ah, yes. Switching foods abruptly.
Exactly. Or suddenly upping the carbs or fiber. That can cause temporary gas while the pet's gut bacteria adjust to the new menu, so to speak.
Okay, now. The smell. Let's talk about the smell. Why is it sometimes so noticeable?
Yeah. Yes, the elephant in the room. Or perhaps the smell from the elephant in the room. It's fascinating, actually. Believe it or not, the sources say that 99% of the gas pets pass is completely odorless.
99%. Really? What gases are those?
Things like nitrogen, oxygen, hydrogen, carbon dioxide, methane. You wouldn't smell those at all.
So it's all down to that last 1%.
Exactly. That tiny fraction contains the smelly stuff. Ammonia, hydrogen sulfide, that's the rotten egg smell, indole, skate hole, volatile amines, short-chain fatty acids.
Wow. And what causes those specific gases?
The key seems to be protein. If protein isn't digested properly earlier on, it reaches the colon, And the bacteria there break it down in a way that produces these really pungent sulfur-containing compounds and other smelly molecules.
So really bad smells often point towards protein not being digested well?
That seemed to be a major factor, yes. Poor protein digestion equals stinkier gas, often.
Okay, and that feels like a natural link to when flatulence might be more than just, gas, when it's a sign of a problem.
Precisely. If a pet has some underlying health issue that affects how they absorb nutrients,
Like what kind of issues?
things like inflammatory bowel disease or conditions where they lose protein through their gut lining, protein-losing enteropathies. These mean more undigested food, including protein, makes it to the colon.
Leading to more bacterial fermentation.
And more gas, often smellier gas too, because of that protein component. So persistent, excessive, or suddenly very smelly flatulence shouldn't just be brushed off.
Makes sense. It's also interesting, our sources mention differences between species,
Yeah, that's quite striking. Flatulence is apparently a very common complaint from dog owners.
but not so much cats.
Seems quite rare in cats, relatively speaking. So if your cat suddenly becomes gassy, that might be more of a red flag than in a dog.
And even within dogs, are some breeds more prone to it than others?
Yes, there are definitely breed predispositions. We talked about swallowing air.
Ah, the brachycephalic breeds, short noses.
Exactly. Pugs, bulldogs, boxers.
Okay.
Their facial structure often means they swallow more air just breathing, and definitely when eating. Also, sporting dogs, and just generally dogs that eat really, really fast. The gluttonous ones, or those in homes where they feel they have to compete for food.
Hmm.
More gulping, more air.
But it's not just those breeds.
No, the sources are clear.
Yeah.
It can happen in any breed, any age, male or female. Those are just tendencies.
So what might an owner actually see or notice if their pet has excessive gas, besides the obvious sound or smell?
Well, the main thing is usually just noticing it happening more often, or perhaps seeming like a larger volume of gas is being passed.
Any signs of discomfort?
Sometimes, yeah. It might be subtle, though. Mild abdominal discomfort could show up as maybe repeated swallowing or restlessness. Maybe they seem a bit lethargic or just off.
And it's crucial to look out for other symptoms alongside the gas, right?
Absolutely critical. If the gas is part of a bigger digestive problem, you might also see diarrhea, vomiting, maybe changes in appetite, eating more or less weight loss, or hearing lots of gurgly noises from their belly. Borborygmus, that's called.
Borborygmus. Good word. So those concurrent signs really point towards needing investigation.
Definitely. They suggest it's likely not just about swallowing air or eating beans.
Okay, let's try and summarize the causes then. The sources list quite a few. We can maybe group them.
Good idea. So, first category, increased air swallowing, the aerophagia.
Right. We've got fast eating, competitive eating,
Respiratory diseases that make them breathe harder,
feeding them right after exercise.
and being one of those short-nosed brachycephalic breeds.
Okay. Category 2, diet-related stuff.
Yep. High levels of those non-absorbable oligosaccharides, soybeans, peas, beans again.
Lots of fermentable fiber lactose from milk, pectin, inulin, psyllium, oat bran.
Slowly digested complex starches, like in some whole grains.
Spoiled food, obviously. Milk products in general.
Abrupt diet changes. And even spices, food additives, certain supplements maybe.
Got it. And the third category, the potentially more serious one,
No.
underlying diseases.
Yeah. And this list is quite broad. It includes acute and chronic intestinal diseases.
Like IBD, protein-losing conditions.
Intestinal dysbiosis, that's an imbalance of gut bacteria.
Yeah.
Neoplasia, which means tumors. Irritable bowel syndrome.
Parasites, infections, bacterial, viral, protozoal.
Food allergies or intolerances. And also exocrine pancreatic insufficiency, where the pancreas doesn't make enough digestive enzymes.
Wow, okay, that's quite a list. Really drives home why persistent gas needs attention.
It really does.
So boiling it down, what are the main risk factors that make a pet more likely to be gassy?
Well, summarizing from the sources, being a nervous eater or a really fast, gluttonous, or competitive eater,
Eating soon after exercise,
being a brachycephalic breed,
experiencing sudden diet changes, or eating spoiled or inappropriate food.
and interestingly, even a sedentary lifestyle. Remember that 1998 study?
Oh, yeah. It found less active dogs had more gas, even if diet wasn't the main issue in that study group, so exercise helps move things along.
Seems like it. Keeps the gut moving.
So if an owner is concerned, when do they or their vet start digging deeper? What's the process?
The first step is usually trying to differentiate between a dietary or behavioral cause and a potential underlying disease,
How did they do that?
mostly through a really detailed history. What food, how much, how often, any recent changes, treats, table scraps, how do they eat, fast, slow, any competition from other pets, the whole picture.
Makes sense. Get the story first, then a physical exam.
Exactly. The vet will do a thorough physical, paying close attention to the abdomen feeling for any pain, bloating, abnormal masses. They'll listen with a stethoscope for gut sounds.
Check their overall condition. Weight.
Right. Assess their body condition score. Maybe a rectal exam, too, in some cases.
And if that history and exam raise suspicions, if it looks like more than just diet or gulping.
That's when diagnostic tests come in. Depending on the suspicion, it could involve a range of things.
Like blood work. Stool tests.
Yep. Complete blood count, biochemistry panel, urinalysis. Fecal tests are crucial, looking for parasites, abnormal bacteria, signs of digestion issues.
Specific tests too, maybe?
Sometimes, yes. Tests like serum TLI to check pancreas function, or cobalamin and folate levels, which can indicate problems in the small intestine.
What about seeing inside? Imaging?
Imaging like abdominal x-rays or ultrasound can be very helpful to look for blockages, thickening of the intestines, tumors, things like that. Sometimes contrast studies are needed.
And in really complex cases.
Might need biopsies, taking small tissue samples from the intestinal lining, often via endoscopy or sometimes surgery, to get a definitive diagnosis for conditions like IBD or cancer.
Okay. So let's shift to solutions. What can owners actually do if their pet is overly gassy? What are the treatment and prevention strategies?
Well, the number one thing is, if an underlying disease is found, treat that specific condition. That's paramount.
Right. Address the root cause. Beyond that.
Activity is beneficial. We mentioned exercise helps gut motility, keeping things moving through, which can help expel gas normally.
And diet, of course. We keep coming back to diet.
Always. Dietary management is key. Simple changes can make a big difference, like feeding smaller meals more frequently.
Instead of one or two big ones.
Exactly. And feeding in a quiet place so they don't feel rushed or stressed. Slowing them down if they bolt their food, maybe using puzzle feeders.
What about changing the food itself?
Often, switching to a highly digestible, lower fiber, lower fat diet is recommended. Vets have prescription diets specifically for this.
Any homemade options?
Sometimes temporarily, yes. For dogs, something simple like boiled chicken and white rice might be suggested. For cats, maybe plain cooked chicken, but remembering cats are obligate carnivores, so you have to ensure nutritional completeness and avoid carbs. Always best to do this under veterinary guidance.
Could just changing the protein or carb source in their regular food help?
It might, yeah. Or eliminating potential triggers like certain additives or supplements. And basic client education is important too.
Meaning?
Discouraging them from letting their pet raid the garbage or eat random stuff outside. Dietary indiscretion, as they call it.
Yes. The midnight snack from the bin. Okay, what about medications or supplements? Are there things that can help?
There are some things mentioned in the sources, but with caveats. Carminatives drugs specifically meant to relieve gas aren't really well studied in pets for safety or efficacy.
What about things that target the smell?
Ingredients like zinc acetate and Yucca shitijura can apparently bind some of the smelly sulfur compounds. Activated charcoal is often thought of.
Doesn't work.
Well, in humans, studies show it might absorb odor in waste, but doesn't really reduce the actual amount or frequency of gas. However, one source did mention dog treats containing activated charcoal, yucca, and zinc acetate did seem to reduce smelly episodes in dogs. So maybe a combination approach.
Interesting. What about common human remedies people might grab, like Pepto-Bismol?
Bismuth subsalicylate, yeah. It could absorb hydrogen sulfide, that rotten egg gas, and has some antibacterial effects.
Yeah.
But it's not for long-term use, and crucially, it's generally considered toxic to cats. So, big warning there.
Definitely no Pepto for kitties. What about simethicone? Gas-X?
Simethicone works by breaking down the surface tension of gas bubbles, making them smaller and easier to pass, but it doesn't stop the gas being produced in the first place.
Okay. Any other supplements?
Pancreatic enzyme supplements can be very helpful, but really only if the pet has been diagnosed with exocrine pancreatic insufficiency.
Right. Specific cases. Are there other contraindications we should know besides bismuth in cats?
Bismuth should also be used cautiously or avoided in dogs with certain conditions too, like bleeding disorders. And as for herbal or botanical remedies, you might see marketed.
Yeah.
The sources basically say the dosage, safety, and effectiveness are largely unknown in pets. So approach with caution.
What about probiotics? Everyone talks about gut health these days.
Probiotics aim to help normalize the gut bacteria. They're generally considered safe to try.
But do they work for gas?
The evidence specifically for reducing flatulence, isn't very strong, according to the sources we looked at. But, if a bacterial imbalance is thought to be part of the problem, they might offer some benefit and are unlikely to cause harm. Worth discussing with a vet.
Okay, so pulling this all together, if you're listening and thinking about your own pet, what are the main prevention tips or key takeaways?
Key prevention strategies would be try to avoid diets very high in those non-absorbable oligosaccharides or highly fermentable fibers we mentioned.
Avoid milk products, spoiled foods, sudden diet changes,
Don't feed them right after strenuous exercise. Manage their eating speed if they're a gulper.
and probiotics might help if disrupted gut bacteria is the main issue.
Potentially, yes.
So the bottom line seems to be occasional gas is often just diet related, maybe behavioral, but if it's persistent, excessive, really smelly, or comes with other signs like diarrhea or vomiting.
Then it warrants a closer look, definitely. Understanding the dietary factors, breed risks, and recognizing those accompanying signs is crucial.
And if you are worried, don't hesitate to chat with your vet.
Absolutely. Always the best course of action for peace of mind and getting the right help for your pet.
Right. So, considering how much things like diet and gut bacteria influence something seemingly simple like flatulence, it really makes you think, doesn't it?
How so?
Well, what other maybe minor seeming aspects of our pets' daily lives or routines could be having a bigger impact on their overall health than we even realize?
Definitely food for thought.